Good evening, TRT and Hormone Optimization Group. My name is Justin. If you've seen some other videos, you already know that. If you're new, hey, welcome on board, and we appreciate you joining the YouTube channel and watching our videos. And hopefully you find these videos very informational and you find them very fruitful in helping you in obtaining your TRT optimization as well as your general health needs. Since I've been on a roll talking about peptides lately, guess what? Today I'm talking about yet another peptide. This time I'm talking about peptides that are related to weight loss. I know that's not quote-unquote TRT specific, but many of the guys in our Facebook group and YouTube channel do come to us routinely because they want to also know about strength training, strength conditioning, weight loss, and general health concerns. Today's peptide is Exenatide. It actually is the generic name of a branded drug that's on the market and has been on the market for 15-ish years, give or take, named Byetta. And this is a peptide that's in the class known as glucagon-like 1 peptides. We often refer to those as GLP-1s or incretin mimetics. And exenatide has been historically used to treat type 2 diabetes. However, it's also starting to be explored in using it to treat obesity and weight loss. Now, exenatide is administered via sub-Q injection twice a day, preferably and ideally on an empty stomach, at least 30 minutes to an hour prior to eating meals. GLP-1s are secreted from the L cells of the small intestine. Believe it or not, GLP-1s were actually discovered as they were derived from the Gila monster's saliva. Not that that should turn you off to it or anything, I just thought it's an interesting fact. Anyway, they exert their weight loss and glucose mediating effects through two primary mechanisms that I will discuss. The first mechanism that GLP-1s help with regulating glucose and mediating weight loss is through delaying gastric emptying. Well, if you delay how fast your stomach clears food, then essentially you're staying fuller longer. Digesting slower equals longer satiety. With that being said, if you are delaying gastric emptying, last thing you want to do is eat to 100% fullness while using these medications. What I actually educate patients to do is when they use these medications, eat to 80% fullness. That way you're not backing up and feeling overly bloated and overly full. Also, GLP-1s help regulate glucose-dependent insulin secretion. This means that insulin is controlled in a more tighter and a more narrow window, and it's more regulated only in the presence of glucose. In other words, if you have an empty stomach, you've been fasting, then these medications really don't exert their positive effects. However, when you eat and get into that postprandial state, that's when these medications really exert their effects. GLP-1s are not known for causing hypoglycemia. Can they cause hypoglycemia? Well, of course they can, but they're historically not known for it. As previously stated, these work in a glucose-dependent manner. In other words, if you have not been eating, then like I said, they don't exert their effects. Contraindications to exenatide are type 1 diabetes, gastroparesis, pancreatitis risk, and that also includes very high triglycerides and an EGFR less than 30. Oh yeah, and multiple endocrine neoplasia syndrome, MENS. I hope you all appreciate this video. I know it's a little off topic and not exactly TRT related, but it's another peptide that is available and another peptide that a lot of patients are starting to implement more in their health practices and their weight loss adventures. Thank you. Y'all have a good night.
And now give this video a thumbs up and go watch one of these videos to learn a ton more about TRT and hormone optimization.